Hi, everyone. How are you doing? Welcome to this presentation. Today, I am talking about what some of the main healthcare areas are that you, as a future leader in healthcare or as a future healthcare project manager, needs to know. The reason for this is that it's very, very crucial that you do have knowledge about the healthcare process because healthcare tends to be a bit complex, at least the one here in the US. And having that background is very, very helpful for you as a project manager to know about it. The other thing is also if you already work in healthcare, but you work in a certain area, it's hard usually to know what goes on in the other areas. Okay. And so you find that knowing what goes on is very, very helpful for you as you look to transition into position of leadership, or in this case, a project manager, which is also leadership. So that is what I'm going to discuss today. Um, my name is Rachel. Why should I talk to you? My name is Rachel Kaiser, and I have been in the healthcare industry for over 20 years. I started out as a senior programmer, business analyst, and therefore I could talk the technical language and also the business side of things. I knew, or I do know the patient journey from beginning to end, and so that's why I come to you teaching you this. Certainly, I've been in different areas of healthcare. Actually, I really started on the insurance side, just so you know, and then eventually within actually the same company because they provided solutions for insurance companies and also solutions on the provider side, which is where a patient goes and sees any kind of clinician. It could be a doctor, it could be a nurse practitioner, it could be a therapist, it could be, anyone that provides clinical services. And so you find that during my journey, I have transitioned into different areas. However, even for me, as someone who was within healthcare, I still had to reposition myself and um, strategically, present myself in a way that would show the next role that I was transitioning into that I actually am a good candidate for the job. I can do the job, but also with my past experience that I bring those skill sets to the current job and add to it, in addition to other things that obviously I would either learn or I would also add with my previous skill sets. So that's what we're going to talk about today. I shared this slide yesterday in my social media posting, but what happened is I wanted to put some context around it, and that's what I'm going to do in this series in the coming weeks, just to talk about this, okay? All right. So there are three main areas within the healthcare patient journey. We have one that they call the front end. It's usually administrative work and operations, whereby a patient comes in and they have to prep for that. So there are many ways this conversation can go, but I'm going to talk about it in a way that is, let's see, slideshow. I'm just trying to show this as a slideshow. I'm going to talk about it in a way that is, in a way that's that is from the patient side, because I could talk about it from the technical or business side of things or operation side, but I'm going to talk about it from the patient side. So, meaning the front side of things, whereby you at least can understand what happens when a patient comes in to get services. Calls in, comes in, could be walking, it could be calling, could be scheduling. Actually themselves these days we have, not all of, not they, but we, including myself, have the opportunity to do that. Probably you've gone to a doctor's office or a hospital where they've told you that you can go and schedule an appointment yourself in the patient portal. That's what that is. A big part of this or proponent of this is a system called Epic. You may not know it's called Epic. but it's called either different names depending on the company or the healthcare organization. It could be called the health chart, patient chart, patient portal, or some other name, okay? But it's the same thing. All right. So, like I said, the first part of this, the first stage is called the front end, and it has a different, by the way, this is going to be high level. So not everything, there's a lot to discuss, but I want to give you enough that you can start with, okay? So well, I say that because I'm going to be talking about within the different stages. There are three main ones. We have the front end, we have the middle end, and then we have the back end. Okay, so each plays a part. The front end is where the patient is front facing. The patient comes in, or the patient comes in, or the patient will be scheduled to come in to see a provider. And then the middle one is whereby after the patient has been seen, what are the things that go behind the scenes? You will not see these, the patient will not even know these, but I am telling you because I've been, I've worked in these areas, and also that you as a project manager, it will be very helpful for you to know these areas. So that's the middle. The third one is going to be what they call the back end. And usually this has to do everything to do with finance. It's very, very detailed. There's a lot that goes on here. It's very intensive in terms of operations. And there's a lot to it. But like I said, we'll get to that further down during this series. However, like I said, also, this is going to be high level to not overwhelm you, but to give you a sense of what really happens and what are the things that you would know, okay? All right, so scheduling. So what happens during scheduling? So I can define scheduling in this case is the booking of patient appointments for care according to the availability of healthcare providers, clinicians, rooms, and or equipment. As a side note, actually, rooms and equipment also can be they usually call them resources, but also they are scheduled because when they schedule you, for example, if a doctor, does a referral for you or says you go complaining of a headache, maybe the doctor can't find out what exactly is happening. When I say you, I mean in third person, like many people, anyone. And so someone he's like, okay, I don't know what's going on. Let me refer you to go and have an MRI or some kind of scan to be done to you. So they will do an order, what's called an order. An order is sent. They'll usually send a document. These days, though, it's all done electronically. It used to be a document, they fax things, but sometimes you as a patient may have a preference maybe for a particular facility to do that for you versus another, and they may fax over an actual paper document. So that is still in use, even though there's still electronic, this can be done electronically, okay? Electronically is usually within the same healthcare system, meaning all the hospitals or facility belong to one healthcare system, okay? For example, here, I'm based in Connecticut. It could be Yale. Yale has several hospitals, several facilities, standalone facilities, outpatient facilities, things like that, okay? So for you, wherever you are, you may know the bigger hospital systems in different states. So that's why I'm saying also the equipment and the rooms all have to be scheduled for someone to go see them or go use them in this case, if it's a resource in terms of a machine or some type of scan, okay? All right, so within the scheduling, there are three areas that one needs to know. So the first one is the provider or the clinician schedule. What happens is here, what they need to know is the availability on the schedule of these, of either one of these, either the provider or the clinician. Okay. Provider, clinician, I use it interchangeably, by the way. it means the same thing. So I'm going to continue using probably provider. It's a bit easier, but that is what it means. Anyone who provides clinical services to a patient. So they will have also what they call appointment types. And what are these appointment types? So whereby there are different reasons that a provider sees a provider will see a patient. For example, if you have someone that's new and you're seeing a certain provider for the first time, they're going to call that a consultation. Usually it's longer. They're trying to get your prior history. And so they're going to schedule that for a longer time. If you have one where you're an existing patient for the provider, it may be that it's a follow-up, okay? Or it's an annual checkup. So usually by annual checkup, maybe they did some orders for you to do blood work, and they're going to give you results during this visit to the doctors. And or the doctor will also do some checkups on you. You know how they do listen to your heart, and then listen maybe to your tummy. If you had some particular problems before in terms of health problems, and maybe you're going to a specialist, they may check that a little bit more, whatever that might be. For women, it could be GYN, just checking to have, the tests and everything else within the pelvic area, that kind of thing, okay? And then within that, that's what brings me to the third point here, which is the appointment duration. Different appointments are going to have different durations, meaning different timelines. The follow-up may have just literally 15 minutes. They're going to ask you, hey, are you okay? What happened? Or that kind of thing. Or if they sent you to have some tests, blood work, the doctor is going to give you the results and make some recommendations depending on the results. And if you're okay, they're like, oh, yeah, good. We'll check back maybe in a year or so. Unless you have any problems, then come and talk to us. Okay, so that's how that happens. All right, the second one is patient information. So what happens is within the system, there has to be the patient information. And that system is the one where they're going to be taking the patient demographic information. And what that means is that your name, the patient name, age, address, and that kind of thing. Essentially, what is this about us, so that when they want to find us in the system, they can type it in and then they pull us up to bring our chat up, to bring a profile up, or to bring our account up. Again, those are words that are used interchangeably: chat, profile, or account, okay? Another thing is your insurance. You may have insurance, you may not have insurance. You could be self-pay, that's what they call not having insurance, or you have insurance. Either one of those, they'll need your insurance, and they'll ask you for it. Take the card, enter it in, and that kind of thing. Scan it and all that kind of thing, enter it in, okay? The second one is if you call in and you want to schedule an appointment, they're going to ask you the reason for the clinic visit. Why? Because this will help them in the end to determine what type of appointment that they can assign you. Remember here, we said appointment types. The reason for that is because it determines also the length of the appointment. So it's like one thing goes into the other, okay? So they'll ask you reason for the clinic visit, and then they'll have that in, they'll enter some summarized notes, at least to give the provider a bit of what it is that you're going in for, because they have to know, okay? Again, also, if you have any prior medical history, for example, at the front desk, the scheduling people are not going to really know your medical history per se. They're not going to go the details. But what happens is that if you had maybe you're not new to the doctor or the provider, and that you had some prior history, as you're calling, you may say, hey, the last time I came in, this happened or that happened. And so I want to now see the doctor or the provider for this reason. So that's why I'm saying prior medical history. this is very dependent on what it is that may be needed, because they may also ask you, the scheduling people may ask, representatives, sorry, they may ask you what some of the prior history is to understand, especially if you're new. They may ask some questions just to add them to the history so that the doctor might have some idea before they see you. Okay. And then the third one. The third one is three things that are needed. A scheduling system. In this case, it's what is going to include all the things that we talked about. Probably this would even have come maybe before, because in order to have the to be able to create a provider schedule and also the patient information to enter, this is what you need to have. I put it number 3, but it's important. It's almost the first one that you need to have. But all in all, these are the main 3 things you have to have. Okay, so you need to have a scheduling system, and this will entail a healthcare scheduling software system platform that are healthcare specific platforms, especially if this is a big organization, if either it's a hospital or if it's a physician or a provider group. When I say group, I mean usually you may find that there's a medical practice that may have more than one providers that are giving those particular services. For example, primary care is just one, several physicians in there, and a patient can choose any physician they would like to see from that. You have another one that could be a certain specialist. It could be orthopedic, meaning, anything to do with bones and broken anything, that has to be worked on. It could be GYN for women. And then also it could be men's health, for example. It could be oncology. It could be urology, anything like that. All those things are what determine, what type of scheduling system can be used. Meaning, if it's a big group, you're going to have a more detailed scheduling system. And then the next one here is a simple scheduling platform. You find that where it's one physician, they have their own practice. And this especially has blown up in the last few years, especially since the pandemic. There are many counselors, medical health, that are broken out into their own, practices. So you have where it's a one person practice. Some of them don't want the, when I say expensive, some may not be expensive, but they may not want to pay the monthly fee. So they may decide to create their simple thing, have a scheduling platform, anything like either Acuity. Second, I just moved something here, and so it went. So you may have scheduling scheduling platforms that are on the market, something like Acuity or Calendly or any other. Even now, actually, Google provides a good scheduling platform. And so people can do that. Like, you can do it yourself, meaning a patient can be given the schedule link, and then they go and create an appointment according to what's available and what also is available for them, like a good days to schedule. Okay, so it could be anything from something simple to something complex. All right. Okay, so all in all, what I want to do here is I wanted to give some. I wanted to provide some information. I already said this in the beginning. I introduced myself, that I empower experienced professionals to get into the healthcare and healthcare project management to become competent and confident leaders. Listen, if you're a future project manager and you haven't been before, it can be very intimidating, because you have people that are looking up to you as a leader, and you have to know, you don't have to know, but at least it helps you that you know these areas, and when you're talking to them, you're talking confidently, and that at least, even though in the beginning you may not know everything, but when they're talking, you understand the language. That's very, very crucial for you. And healthcare, and I believe other areas also, are one of those areas where they would like you to know about what some of the systems are, the processes, and that kind of thing. And so knowing this kind of information is very crucial. Okay, so I hope this was helpful. The next one we'll be visiting next time will be registration, where patients are registered. It's also very short. It comes kind of integrates with scheduling, but it's an area that also one needs to understand at least how that works. Okay. So I hope this was helpful. If you have any questions, certainly do contact me and let me know. Feel free to follow me on the social platforms on LinkedIn. I'm on LinkedIn as Rachel M. Kaiser. I'm on Twitter or X as Rachel M. Kaiser. And also I'm on Facebook at the same name. And I would invite you also to join our group. I have a group where I also provide this information. So you're very welcome to join us. The information will be in the post today. So thank you so much. I hope this was helpful. Have a good one. Bye-bye.